family of a Windsor man is concerned about the use of antipsychotics in long-term care facilities. They say their loved one was given antipsychotics without having been diagnosed with any sort of psychosis, and they're not alone. Many say those types of medications are being overused in the understaffed facilities. The CBC's Jacob Barker reports.
In life, Robert Pinto was known as a charismatic professor of philosophy at the University of Windsor, but it's the years he spent in long-term care his daughter Laura is concerned about.
Basically like a zombie, like he was in a non-responsive state most of the time.
Pinto moved to Southwood Lakes, an extended care facility in Windsor, in 2017. In the facility, his daughter says Pinto would wander.
We would come in and he would be badly bruised. There would be blood all over his room floor.
Laura says her father was prescribed antipsychotic medications of particular concern, Haldol, a potent antipsychotic meant to manage symptoms of schizophrenia, but she says he was never diagnosed with psychosis. This pharmacist says Haldol has come under some scrutiny in the past.
Haldol does have somewhat of a bad reputation, partly because it has been used in what we call chemical restraint when someone is acutely acting out aggressively. It doesn't particularly have a place these days since there are so many other medications.
For the nursing home?
This is a call Laura says she got from her father's home explaining the doctor's decision.
He does say that in light of everything, that Bob not being able to eat or drink in this twilight sort of state is a consequence of it, but that's something that we'll be expecting to see with this approach.
I understood that recording to be, he's not going to eat or drink and we're not going to feed him or provide him with a feeding tube or anything like that.
Laura says 2 physicians have told her her father was being over-medicated. The most recent data for Southwood Lakes shows the rate of people at the home who have not been diagnosed with psychosis who are receiving antipsychotics is nearly 30%. That's more than 10% above the provincial average.
It's a high percentage for me. I will accept 5%, 8%, because they are always, 2, 3, 4, depending on the number of residents in the LTC that are unmanageable.
This behavioral neurologist says antipsychotics should only be used in very specific circumstances. Behavioral interventions should be first.
Don't treat it like, this patient has Alzheimer's disease and is aggressive and is violent. Go through, know the patient, know how he or she you will communicate.
A statement from Ontario long-term care clinicians says that the understanding around antipsychotic medication has changed, and that until a few years ago, it was believed that residents who were prescribed antipsychotic medication in the community or at a hospital would have to stay on it permanently. It says today the goal is to prescribe antipsychotics for the right symptoms, at the right dose, and only for as long as is needed. In a statement, Extended Care says its teams do work to support residents with responsive behaviors through a range of interventions, that they require non-pharmaceutical supports to be used first, and that medication is used appropriately only as a last resort, through physician direction and in collaboration with residents and their families. And while Extended Care did not address Pinto's case directly, it said in 2020 the average rate of antipsychotic use across their Ontario homes was in line with the National Canadian Institute for Health Information average and 3 percentage points below the Ontario average. At the end of Pinto's life, he was sent to hospital with a respiratory illness. During that time, he was taken off the medication.
Once everything was out of his system, he became a lot more alert. He became conversational. He still had dementia, but he had a personality again. And I think we have to speak out against it, because if we don't speak out about his experience and about the changes that need to take place, nothing will change.
Jacob Barker, CBC News, Windsor.